The title of the paper is The Respiratory Health Effects of Substitution of E-cigarettes for Tobacco Smoking. And what we did was we searched for all the studies that tested lung function after people who smoke substituted e-cigarettes. We found 16 studies that conducted these kinds of tests. There were 66 types of testing measurements done overall. And out of those 66 tests, 65% were not significant, meaning there was no noticeable change in functioning. Declines in functioning were found in 14 tests. 10 of those were for the acute tests. But what's interesting was all of these findings of declining function were from the low-quality studies at high risk of bias. Only 9 studies showed any sort of improvements over follow-up. But the issue is that none of the changes, the declines, or the improvements were large enough to be of clinical relevance, meaning that a doctor wouldn't even note them on your record as important. With almost 2/3 of the tests not significant, and all the other tests below the threshold of clinical concern, the basic takeaway is this indicates that e-cigarette substitution for smoking likely does not result in additional harm to respiratory health, at least in the short term.